short word about sterility. Every single operative procedure requires completely, perfectly sterile instruments. We achieve that by the use of this autoclave. It treats the instruments at high temperature and high pressure to achieve that perfect sterilization. My assistant, Joy, will explain in a little bit more detail. Sterility of the instruments is achieved and monitored by several mechanisms. Joy, would you explain to us how that works?
One thing we use is a biological spore tester that is used daily to monitor the sterilizer itself, an integrator that verifies that the steam and the temperature is achieved, and also an indicator inside each pack that shows that the steam penetrated and the sterilizer reached its temperature.
So, Joy, do you think that this mechanism is adequate for achieving sterilization for our tools?
I think it's more than adequate.
Thank you so much. Hi, I'm Dr. Tom Trevisani. I'd like to share with you some of the information about breast augmentation. Whenever we do a breast augmentation, the consultation process always begins with you filling out some papers to help us get to know you. Once you and I meet, by that time you will have handled the breast implants and have gone through some degree of a sizing process, but it will not be formalized and finalized until you and I meet. When we do meet, we'll go over the following. I will emphasize to you that our goal is to get you your best looking breasts. To do that, we have to do an operation. This operation has several risks. They are: 1, nipple sensation. You may lose feeling in one or both nipples. We'll talk about that in detail. Next, bleeding and infection. Whenever you do an operation, you always have the risk of infection. Your environment plays a large role in this. Therefore, we insist on keeping your hands clean. So postoperatively, wash your hands, wash your hands, wash your hands. Bleeding. If you disobey your post-op instructions, you may bleed. We can fix it, but we'd like to avoid it. So post-operative bleeding can be avoided by following your post-op instructions. What do we do on the day of surgery? On the day of surgery, we go over all the paperwork again and make sure everything's in order. The anesthetist will then talk to you and will take you to the operating room. In the operating room, we'll make a small incision. We will create a space in your body where the implant will go. Usually that space will be under the muscle. Sometimes it will be over the muscle. We'll talk about that in detail at your consultation. So creation of the space. Remember, from that point on, your body will try very hard to eliminate this foreign object. That process causes scar tissue, which may result in firmness of the breast. So capsular contracture is a term you'll need to learn about, referring to the hardness of your breast following your breast augmentation. Will help show you ways to prevent or minimize that. The last two things are related to the implant. They come to us empty. We have to fill them. The company says if you should have a spontaneous deflation and go flat, the company will provide the implant at no charge to you and will put it in at no surgical fee. So deflation, although rare, is covered completely by the company. Also, the concept of wrinkling. All of these implants wrinkle. There's no way to avoid it. So what we do is overfill the bag in order to reduce the wrinkling. Some implants lose that smoothness and may require reinsertion of some fluid to reestablish the smoothness. The other thing we do for wrinkles is to put it under the muscle. That will help significantly. Implant under the muscle. So in review, the goal is to get you your best looking breasts. To achieve it, we have to do a surgical procedure. This operation has several risk factors. They are nipple sensory loss, bleeding, infection, the concept of the capsular contracture, the space within your body, leakage, and wrinkling. Those are the risk factors for breast augmentation. I'll see you at your consultation. Hello, Dr. Tom here, continuing in our attempt to communicate with you pertinent information prior to you and I meeting for your consultation. Keep in mind, cosmetic surgery can help you be your best. We'll help you to make your right choices. Also keep in mind, every operative procedure has benefits and risks. We'll discuss those in detail during our live consultation. I hope that this video has helped serve as an introduction to your consultation process, and hopefully you'll develop some good questions, and we'll move forward now with your consultation. Thank you so much. See you soon.